We're often asked about where's my back pain coming from. What we prefer to do is teach you a little bit about our approach to back pain. The basic things that we want to look at, or the first thing, is to make sure that you don't have any of the bad things that could potentially cause back pain, like cancers, fractures, infections, or inflammation. We then want to look to make sure that are your nerves okay, and that's why we take a history and do that physical examination. And then we ask you to watch for problems, the change in symptoms. So if you ever develop what we call red flags, which is weakness, there's problems with going to the bathroom, fevers, night sweats, or a severe loss of weight, then we would ask that you get reassessed either by, depending on how urgently it changes, by the emergency room or by your family physician. Once we've ruled out the more serious health issues and counseled you on things to watch for that would change our impression about what your diagnosis is, most people will be diagnosed with a condition called mechanical low back pain, which means one of the structures in your back is causing you pain. The most common cause is the disc, which is like a shock absorber between the two parts of your spine, and you have multiple levels throughout the entire spine. And then there's a number of joints that can also cause problems as well. Most patients want to know, what about tests? Do I need a blood test or an X-ray or an MRI? Generally, we usually do those tests to actually rule out the more worrisome health issues like cancers or fractures or infections. In the case of mechanical back pain, it's not often that you require testing, as it does not really change the outcome of the outcome. It doesn't really change the treatment options that we can offer you. And then a lot of times people also want to know, what about surgery? How can I fix this problem? And so surgery for back problems is usually reserved again for the more serious health issues that we discussed. In the cases of people that have mechanical back pain, however, there's not a lot of good science that suggests it's going to help you with your back pain, and in some cases it can actually make it worse. So while we can't fix your back pain, we might be able to help you manage it a bit better. I usually talk about 5 big categories of treatment: lifestyle modifications, mental health and functional support, physical therapies. So some examples of these are listed here. Lifestyle modifications include smoking, common ergonomic assessments, yogas and Pilates, regular exercise. We can also consider things like cognitive behavioral therapy or mindfulness. An occupational therapist can help to try and make you function better in your day-to-day life. And then there's a chronic pain program that can teach you a little bit about living with chronic pain. There's various therapists that help people with back pain. This includes a physiotherapist, a chiropractor, an acupuncturist, massage therapist, or an osteopath. So these are things that you can look into as well if you have the resources and or insurance coverage. From a medication standpoint, there are a number of medications you can trial, and this can include medications you rub into the areas, ones that you take once in a while, like anti-inflammatories. Although we have to be a little bit careful about the consumption of narcotics and the risk of dependency. There's some medications that can be prescribed to help you on a regular basis if we can find one that doesn't give you a lot of side effects, and that also helps to improve your pain. And then people ask a lot about cannabis, and there's 2 main forms: pill-based cannabis products, and then there's a real interest these days on plant-based cannabis, but there's limited data on the benefits as well as the long-term side effects. There's different types of injections that can be done. It doesn't work for everyone, but in those people it works for, it can sometimes provide a percentage of relief, but they do have to be repeated a few times a year depending on the injection. After this, we will summarize our findings as well as some of the other options that your family physician can consider for treatment. But we'll also enroll you in our 8-week online rehab program that you can do through our mobile application. So some common questions are, will this go away? Generally what I tell people is that we hope that it does, but sometimes it's unlikely that it will go completely. What we try to do is help you manage it a bit better. A lot of times people also want to know, like, what can I do to keep this from getting worse so that I don't end up in a wheelchair or really disabled as I get older? Most of the data that we have available today suggests the more active we can keep you, the better off it is for your overall health, for your mental health, as well as possibly the health of your back. So I generally tell people that try and find activities that you can do that don't flare your pain, or ones that you like doing that you can maybe modify so that you could do it less intensely or for less amount of time, so you can still stay active and do the things you enjoy doing. And this is where a good therapist can also help you select the appropriate activities and exercises. And then in terms of follow-up, what we'll do is we'll make a number of recommendations through a special report back to your family doctor, and so that you can follow up with them and help, and your family doctor along with your therapist can help you manage your back pain. Thank, thank you very much. We look forward to meeting with you.